So welcome back. We are still continuing to talk about on the subject of stimulants, the abuse of stimulants. So we have previously talked about caffeine, and also we talked about amphetamine. So we will continue on the subject of amphetamine and just broach upon the subject of amphetamine type stimulants. So we have methamphetamine, which is also commonly known as ice and glass, etc. So when we talk about ice and glass, these are formulations that can be smoked. And then we have methylphenidate, which is a legal drug, indicated drug to treat one of the common psychiatric disorders of today among children and some adults, having attention deficit hyperactivity disorder. So, but an issue about ADHD is that it is sometimes difficult to differentiate whether this person is having ADHD or it's just some underlying social problems. It might be just a manifestation of underlying social issues, especially parenting issues. And another issue with treating ADHD with methylphenidate is that we don't know the long-term effects of giving methylphenidate, so which is not cool. So you don't know what's going to happen in the long run when you give or when you prescribe patients with methylphenidate. So methylphenidate is a drug that may be crushed, and after crushed it can be snorted. Okay, just like you snort, you may snort cocaine. So this is also another drug that people can snort. And then we have pimoline, which we are not going to talk about today. And then moving on, we will continue to talk about another one of the main and one of the most popular stimulants, which is cocaine. So cocaine is an alkaloid which is prepared from leaves of the coca bush, which is known as Erythroxylum coca, which were commonly planted or available in Colombia, Bolivia, and Peru in the Americas. So as for cocaine hydrochloride, it's a white powder, and it's I think many of you have seen this in movies. It's in the form of a white powder and it's easy to transport. The route of administration, or the route of administration, it can be given in almost any route. You can take it by inhalation, or you can take it intravenously, intramuscularly. Or there are so many. Almost any route can be used to abuse cocaine. So the effects of cocaine: it's a powerful CNS stimulant, causes elevated mood, it makes a person become energetic, a person becomes more alert and also self-confident. These are all typical effects, adrenergic effects that you can see with adrenaline, and it's similar to what we see in the users of amphetamine. So physical effects: causes increase in heart rate. So your heart rate will go up from 60, 50, 70, becomes 90, 100, 150, 120. And your blood pressure will go up, say from 120 over 80, becomes 140 over 90, or 140 over 100, or higher than that. And the temperature also might go up from 37 to 38, etc. So it becomes higher and higher. And you also develop dilated pupils. So your pupil, which is probably, for example, if it's just a few millimeters, maybe 3 millimeters, 4 millimeters, becomes bigger. So your pupil becomes the size increased. Okay, the diameter of the pupil becomes increased due to the effects of cocaine. So at high doses, it can cause cardiac and respiratory arrest, and which potentially can lead to death. And it might also cause bleeding in your brain, so intracerebral hemorrhage. Tolerance has been seen to the hyperthermic, meaning the increase in your body temperature due to cocaine, and also tolerance to the convulsant, the fitting effects or the convulsing effects of cocaine, and also tolerance can develop to the cardiovascular effects, mainly increase in heart rate and increased blood pressure will require a higher dose, and also an increase in the threshold to get a fit will be increased, and also you will also require a higher dose to cause an increase in body temperature with a prolonged use of cocaine. And probably you might develop tolerance to the mood elevating effects of cocaine. And as the dose and frequency increase, the dysphoric effects, okay, so which is the opposite effect of euphoria. As opposed to being euphoric, you develop dysphoria. You might become irritable, suspicious, and also restless. So these are some of the unwanted effects of cocaine that you may develop as you increase in the dose that you use, and also the frequency. Say if you used to use cocaine once a week, and then you increase it to a daily use. So what you will see in the long run is that you might, instead of getting the euphoric effects, instead of becoming high, so you might develop, just instead of getting that, you'll become irritable, become suspicious, and also you might become restless. So you also might develop physical dependence to cocaine. So you might, and you can see withdrawals if you stop the drug abruptly. You might become lethargic, depressed, and you will develop social withdrawal, tremors, muscle pain, and also you have problems with eating and sleeping. And some of this might be seen on the EEG, electroencephalogram, which is probably not commonly used to monitor patients with cocaine abuse issues. So this is probably more for research purposes. That's why they monitor the EEG. Otherwise, it's not commonly done. And then we have what's known as a crash, a severe form of withdrawals, so which can last a few hours or days. So someone becomes dysphoric, okay, the mood goes down, and then you have intense craving, excessive sleepiness, become very sleepy. You become paranoid. Okay, you feel that people are trying to hurt you, and become agitated, and you might have suicidal thoughts, which can be dangerous. Psychological dependence may ensue when you abuse cocaine, as your normal life pattern has been disrupted, and everything becomes subdued to the need for cocaine. It's as if you are worshipping cocaine. Everything that you do in your life, whether your family life, your work life, exercise, eating, everything pleasurable, etc., becomes subdued, becomes influenced and heavily influenced by the need for cocaine. So your need for cocaine will overcome everything else in your life. So this is really a problem once you start developing this. So the mechanism of action for cocaine it's a bit complex and not fully understood. So, but it's believed to be affecting the dopaminergic system in your brain, and it might also affect your noradrenergic and serotonin pathways in the brain. So toxicity with cocaine will cause anxiety, restlessness, apprehension. You become very suspicious, hypervigilant, too excessively aware of your surroundings, paranoidal. You feel that people are trying to harm you and kill you, etc. So stimulation of the nervous system might cause muscle twitching, nausea, vomiting, increase in heart rate, increase in blood pressure. You might develop irregular respiration, and also you may throw a fit, convulsions. And depression of the central nervous system may lead to circulatory and respiratory failure. And also loss of reflexes. Okay, you can't see the reflexes anymore, the knee-jerk reflexes, etc., Babinski reflex. And you might later develop unconsciousness and death. So we'll stop here and continue in the next video. Thank you.